speaker today is Kathy, and Kathy's 30-year history as an RN has most recently led her to a job on the pre-anesthesia clinic at Evergreen Hospital in Kirkland. This is much closer, isn't it? Okay. Were you at Children's Hospital before?
No.
Okay.
One of the other companies.
Her responsibility is to screen every patient for potential anesthesia and medical problems. Today, she will encourage you to take responsibility for the medications you take. Using the Communication and Leadership book, speech number 9, Persuade with Power. Please welcome Kathy.
It is a busy day at work. You're hungry, and the cafeteria is closed. You go to the basement, find the vending machine, and push for a burrito. You zap the bean and cheese burrito in the microwave and pop it into your mouth. You feel the ooze of bean and cheese in your mouth. You feel full and satisfied. But within an hour, you have abdominal pains. They radiate to your chest. You have a wave of nausea, and you feel a little short of breath. You're certain you're having a heart attack. You enter the ER. Amidst the pain and flurry, the nurse is attempting to find out about your health history. She wants to know the medications you take. But you had no idea you were going to end up in the emergency room that day. You don't know what you're taking. You try to remember there's something for a blood pressure. It's blue. You know that blue pill everyone takes. She looks at you with a raised eyebrow. Oh, Wellbutrin. Oh, I do know I'm taking that for anxiety. But I was feeling good, and so I stopped taking it. No, I didn't really talk to my doctor about that. I just stopped that on my own. Oh, there is a third pill, and I'm taking something the doctor gave me. I don't really know. I don't remember why I'm taking it, and I don't remember what it's for. The nurse looks very frustrated, and you say, well, maybe she could call your primary care physician. You've seen them for years, and they know all about your health. She places a call, only to be referred to the answering machine 3 times. The office is just too busy to pick up and give them the information. How about the pharmacy? You've gone there for years. They fill your medication. Certainly they would have a current list. While she's on the line, being assured that her call is important, she has to decide whether she should continue on hold or attempt to give you the care that you need at this point. Only you can be responsible for your medications. You need to know what you take, you need to know how much you take, and you need to know why you are taking it. You need to have a list on you at all times. It could be in your wallet, and I know for some of you may have so many that it would mean a new wallet or a change of purse. But nowadays with the computer, you can size it down to something small and slip it in your purse or wallet. And you need to have a copy in your home. If the medics are called to your home, they may have no idea if you are not able to tell them the medications that you are on, and they just don't have time to ransack your entire home to find them. It's important to have it somewhere near a computer or maybe a refrigerator. Certainly if you're on a whole list of psychiatric medications, you probably don't want to have it out where everybody can see it, but the idea is to be able to find it quickly and easily. It's also important to have it in your wallet or purse, because if you're in a car accident, and there again, you're needing some assistance, no one has any idea how to help you. Your medications can reveal whether you have high blood pressure, whether you're diabetic. What if you're on a blood thinner? Nobody would have any idea if it wasn't written down and you weren't able to tell them. If you had to be taken for an emergency surgery, that would be imperative for us to know that. When you write the information down, be sure that it's clear. I receive little notes like this all the time. People write them in a little small, folded, little wad, and so often, if it's written in a pencil, I could barely even read it. So make sure that it's legible. Like I say, if it's on the computer, would be best, but if not, make sure that it's written in a pen so you can read it. If you're giving the information over the phone about your medications to someone, be sure you spell it. It's easy to confuse medications. For instance, Zantac, that is usually taken for GI symptoms, can be confused with Xanax, which is taken for anxiety. If you give those wrong, you may feel like you want something for anxiety. It's also important to know the dose. A lot of patients will say, well, I'm taking the lowest dose of all. And then I have them call me back later, and they're on one of the lower doses, but it's not the lowest dose. So there's a big difference between a 1.25 and a 0.25. So it's very important that you get the correct dosage down. And then know what's ordered for you. Know why you're taking it. You're responsible. Don't take a prescription from your physician, fill it, and just start taking it without knowing what that was given to you for. Having surgery, when you do, and if you have surgery, make sure you take a copy of your medications not only to the surgeon but the hospital. They don't communicate as well as you think they do. And make sure that you always let anybody, whether it's in an emergency type situation or a planned situation where you're coming to the hospital for a surgery, know if you're taking any herbal remedies or, for instance, like a vitamin E and fish oil, which can thin your blood. We do have patients stop that before your surgery. I would encourage you not to give this responsibility of your medications to someone else. We never know when we may become ill, when we may become in an accident, when we may have to call for help from our homes. We need to know what we're taking. It needs to be documented. It is your responsibility and prerogative